Hello, my name is Kushinga Bvute. I am a final year MPH student majoring in health policy and leadership at the Loma Linda University. I had the privilege of being an intern for the Health Technical Learning Lab for the fall quarter in 2018. And I would like to welcome you to my presentation on an area of interest, which is the environmental health topic. This presentation aims to just provide you with a broad overview of the principles of environmental health. To start this presentation, I will define what environmental health is. Environmental health is basically a branch of public health which is concerned with all aspects of the natural and the built environment that basically affects human health. According to the WHO, environmental health addresses three main areas. It looks at the physical, the chemical, and the biological factors external to a person and all the related behaviors. Now, there are so many ways that the environment affects our well-being. As public health officers, we are called upon to address these environmental issues that affect human health. And we basically need to prevent human injury and illnesses by being able to intentionally identify the hazards. It's almost like we're being asked to be the detectives on the ground and look for sources of hazardous agents that affect human health. We're also asked to do something about it once we see the exposures so that we can try and limit any diseases that might arise from the continuous exposures. There are a lot of common sources of concern when we look at the health impacts that arise from the environment. As you can see from this informatic from the WHO, concern arises from the pollution of air and water, contamination of food, chemical exposures at work, and more so the chemical exposures in the home. Home exposure actually tends to be a little bit higher than the workplace. People have hobbies that require utilization of chemicals. Some people like to use dyes. Even when we empower people to be self-employed, and when they start projects, they normally use adhesives and solvents. And unlike the exposure that people get in an industrial setting, people who work from home tend to have inadequate safety training, and they also have limited protective clothing and equipment. Sometimes they are confined to rooms that have poor ventilation, and they don't practice adequate disposal practices. There are a broad range of health conditions that are specifically related to the environment. These include infectious and parasitic diseases, neonatal and nutritional conditions, non-communicable diseases, congenital anomalies, unintentional injuries, and unintentional poisoning. The first group of conditions that I will talk about are the infectious and parasitic diseases. The figures that you are going to see in the next few slides are from the WHO, and they illustrate the diseases with the highest preventable disease burden from environmental risk in DALYs, the disability adjusted life years, which is a combined measure of years of life lost due to mortality and years of life lived with disability from 2012. I will be looking at three main groups within the infectious diseases. I will look at the conditions that affect the respiratory tract, the gastrointestinal tract, and vector-borne illnesses. 52 million people each year will have lower respiratory tract illness related to environmental causes. Acute respiratory tract infections are common among the under fives, and it's a common cause of morbidity and mortality within the under 5 age group. All these above mentioned conditions are linked to air pollution, secondhand tobacco smoke, and household pollution. In fact, as many as 4.5 million deaths occur each year due to indoor air pollution from the use of solid fuels as a source of energy for cooking. Another infectious disease linked to the respiratory tract and related to the environment is tuberculosis. Um, Environmental conditions that do not provide adequate ventilation and favors overcrowding propagates the spread of tuberculosis. The next group of diseases affect the gastrointestinal tract. Globally, 1.2 billion people lack clean water, and waterborne infections account for 80% of all the infectious diseases worldwide. Diarrhea, which is related to drinking water quality, sanitation, inadequate hygiene practices, affects as many as 57 million people each year. Lastly, vector-borne illnesses, malaria, 23 million people are affected by malaria. And again, this is related to the environmental exposure, particularly the influence and impact of climate change, which has affected the geographical areas where malaria is pandemic. Other breeds of mosquitoes, such as the Aedes mosquito, which is the primary vector for dengue, chikungunya, and Zika virus, have also been affected by climate change, because climate change has extended the transmission season and shortened the mosquito life cycle as well. So we're finding that we're getting more areas that are reporting such vector-borne illnesses. Neonatal and nutritional conditions are also related to the environment, and protein energy malnutrition can also be traced back to climate change, which affects food security. Lastly, when we look at conditions that affect the newborn, there is enough statistics to link prenatal exposure to chemicals with congenital anomalies. The next group of conditions are the non-communicable diseases. There is a strong association between the environmental exposure and non-communicable diseases. As many as 49 million people have cancers that are related to environmental exposures, such as ionizing and ultraviolet radiation. Mental health conditions are associated with environmental exposures, either in the workforce, and unipolar and depressive disorders have been found in populations that have been forced into resettlement. As many as 119 people, 119 million people, suffer from cardiovascular diseases due to secondhand smoking and ambient air pollution. Other conditions related to the environment include asthma and chronic obstructive pulmonary diseases, which are related to air pollution, secondhand tobacco smoke, indoor mold and dampness. And the last group is the musculoskeletal diseases, where communities have to lift and carry heavy loads, which can lead to back pain as they look for water and fuel for household needs or work in industries that require lifting heavy loads. The last group of diseases I'll mention are injuries that arise from road traffic accidents or other unintentional poisoning. Unintentional poisoning affects communities that rely heavily on agriculture. As many as 25 million agricultural workers worldwide and an unknown number of bystanders, like the image here, there's a child who's in the same field where an adult is spraying. The unknown number of bystanders, or even people who consume food that has still got residue of pesticides, experience some form of unintentional pesticide poisoning each year. Other injuries as well include falls, um, fires from, like I mentioned, cooking with solid fuels, and drownings as well from unsafe water environments. Okay. There is a disparity on the geographic distribution of disease burden attributable to the environmental issues. As you can see from this map, these issues tend to affect the less economically developed nations. These developing nations do have an increase in industrial pollution, and unfortunately, there is a shift of industrial production from developed nations to the low and middle income countries where environmental laws are less stringent and where the enforcement of environmental laws is often non-existent. There's also a practice of shipping hazardous waste into these developing countries for recycling or storage. Air pollution and contamination of water and food supply is still a major concern in these developing countries. And unfortunately, these same regions also experience the rise in global threats that arise from climate change. Having said that, there's also a disparity in the distribution of those people who are affected by environmentally related conditions within the developed nations. Although developed nations have taken steps over the past decade to address air pollution and contamination of drinking water, developed nations still face challenges around the safety of chemicals in consumer products. And there is a rising concern about the number of hazardous chemicals that are being identified. The disparity in geographic distribution within the developed nation tends to affect non-white communities that have between 1.7 and 2.3 times more of a risk because of the neighborhoods that they live being closer to hazardous waste facilities. As many as 9.2 million people within the United States still live in neighborhoods within a 3-kilometer radius from commercial hazardous waste facilities. There is a disparity in the demographic Distribution of the disease burden attributable to environmental issues. When we look at environmental exposures, the more vulnerable populations um, are those who have a higher risk of health from low exposures. And our vulnerable populations include pregnant women, young children, especially the under 5 age group. Children are physiologically and cognitively immature and unable to respond to threats appropriately. And the third group include the elderly, adults between the age of 50 to 75 years of age. According to the WHO, 4.9 million deaths a year occur within the elderly related to environmental exposures. And the most common forms of disease conditions are the non-communicable diseases and the unintentional injuries. Children are especially vulnerable to exposure to toxic material. If we look at the physiology of children, for each kg body weight, children tend to breathe more air, they have a higher minute ventilation, so they're exposed to greater concentrations of air pollutants. They drink more water and they eat more food per kg body weight than adults do. Children also spend more time outdoors, so they have a greater exposure to toxins. They're more likely to be bitten outside by insects and vectors. And as they grow, toddlers have frequent hand to mouth activity. So they consume dust and soil, which will have a higher concentration of things such as lead, pesticides, or polycyclic aromatic hydrocarbons, or other compounds that are known to be associated with diseases. Unfortunately, children also have windows of vulnerability where these exposures can actually cause permanent disabilities. Um, Fetuses and young children are developing their organs, so they're more susceptible to long-term damage from neurotoxins. As their organs are developing, you know, a lower concentration can cause disruption. In fact, in the mid 90s, scientists realized that environmental exposures to certain chemicals led to the activation of estrogen receptors. And they quantified this group of chemicals that could do that and named them endocrine disruptors. So, over the years, certain pesticides and industrial chemicals have been classified as endocrine disruptors. And unlike adults who will have a relatively resilient endocrine system where the blood levels of that particular chemical is higher within their body and they have a mature regulatory system, children are on the other end of the spectrum. Children will tend to have lower levels of these estrogen hormones, and their regulatory system are not fully developed. So, a slight fluctuation in these hormones in a child, particularly to an organ that is very sensitive to that particular hormone, can lead to permanent structural and functional damage. Um, Another reason why children are vulnerable is that they also have a lifetime to manifest the health effects of these exposures. And numerous diseases in adulthood and in the aging population actually can be traced to having some form of an origin in an environmental exposure that Environmental issues, unfortunately, are also difficult to assess. Exposures are complex, they're cumulative, and sometimes they are unquantifiable. And the diseases that are linked to exposures are often multifactorial with long latency period, meaning that the time from the exposure to the time the disease manifests itself through some form of signs or symptoms can be many years, if not decades. So, the important information that can link an exposure to a disease outcome sometimes is often patchy. Um, there are also other prohibiting factors when it comes to trying to access information about chemicals within products. There are confidential business information claims that organizations have that make it difficult for people who are trying to inquire about the content and chemical composition of products um, are unable to access the full list of ingredients. And there are as many as 100,000 chemicals on the market today, but only a few hundred of these have been tested for toxicity. So it is really difficult to assess, the vast extent of exposure in environmental health. Um, there are many hazardous chemicals that, like I said, haven't gone testing, and they're not prioritized for emission reporting or environmental monitoring, especially in less economically developed countries. And the result is that you've got a complete lack of information on the potential health risk from thousands of chemicals. The other disadvantage is that population based studies in environmental health are also quite difficult to perform. Having said that, there is a rise in efforts to have more organizations include efforts to prevent diseases through healthy environments. The extent to which everybody is trying to achieve, the sustainable development agenda actually relies on improving environmental health. There's a role for environmental health in literally all of the sustainable development goals. If we just pick on a few, if you look at goal number 2, zero hunger, we're trying to aim increased productivity, but as we are trying to do that, there's an opportunity to raise awareness about chemical exposures. If we jump to goal number 7, trying to address affordable and clean energy, there's ways that organizations can incorporate the importance of ventilation for communities that still use solid fuel to cook, and to educate populations on hazardous emission. Goal 9 talks about industries. For communities that reside near factories, we need to educate them on the harmful release of waste sites and even the dangers associated with reusing containers that might have been originally storing chemicals, but some people tend to go and help themselves and wash them and use them for domestic use. Um, Goal number 10 is quite important because when we talk about reducing inequalities within environmental health, we immediately think of environmental justice. Um, and we lobby for ways of eliminating discriminatory laws, particularly the type of accommodation and the location of accommodation for the marginalized community. Um, Low-income people, people of color who have this unfortunate high disproportionate burden of environmental risk, need people who are going to use their influence to advocate for better housing quality, more green spaces, and just to make sure that everybody gets a fair chance to have as few number of exposure to hazardous chemicals. So, having said that, I hope that this brief talk and a brief overview has promoted the audience to think on ways on how you as an organization, as ADRA, can link the main sectors of impact that your organization implements to primary prevention opportunities that address environmental health. Um, there are multiple ways in which an organization like ADRA can be a voice and make an impact and influence communities to improve their environment. It could be through education, it could be through advocacy, or it could be trying to find how your influence can limit the exposure and prevent diseases through a healthier environment. Thank you very much for your attention, and I hope that this presentation has been of benefit to, as you know, as we try and raise the awareness of environmental health. Thank you very much for your time.